Hi, my name is Paige Bowie. I am a Deputy Chief for the Alameda County Fire Department, and I am the Program Manager for the Alternative Response Unit in partnership with Cardea Health, our nonprofit, and I am based out of San Leandro. Outside of work, I am a wife, mother, and daughter. That keeps me just as busy, if not busier, but I have no complaints and would not have it any other way. The community in San Leandro is such a wonderful, special city. It really does, though, need the services that the Alternative Response Unit provides. Between fire, EMS, and police, Alternative Response is the fourth leg of the 911 system. I truly believe that is the case, and that is where we're heading. There's lacking the appropriate response for clients with mental health issues, substance use abuse, are unhoused. It is overwhelming for our traditional first responders to handle. And I think that's where alternative responders come in, because they do have the training and the time and the capacity to help when our other first responders, that's not what they're trained to do. These teams exist to work on solving this problem. And of course, these teams cannot solve this problem alone, but it is a necessary piece of the equation. We collect over 40 different metrics on our team. One of them is our diversion rate. We are responding to vast majority of our calls as a solo response, meaning without police, over 90%. And that's 4 days a week, averaging over 10 calls a day in the city of San Leandro. And we do extensive follow-up. The team is, if they're not busy on a call, they are always following up on other clients, including calls when they are not on duty. Police department relays those calls to our team and they will follow up when they get back in service. We've also noted that repeat calls to 911 that are appropriate for this team to respond to have dropped pretty significantly. The team takes pride in trying to solve these problems and really help out in the community of San Leandro. What's the cost of running an alternative response team versus sending a police officer to a call? I think the community of alternative response is getting to the point where we can measure that a little more accurately, but you have to ask, what's the cost of a client that's on the street not getting that help right now? What's the cost down the line to the client, to the community, to other first responders? So you can see why it's a complicated metric. I know there are a lot of smart people working on this, but at this point I don't have a dollar figure. I would continue to say, though, that the proof is in the fact that these clients are getting the help that they were not otherwise getting before the team existed. Our team also has access to 4 medically supported respite shelter beds, and that is a great component of this team provided by our nonprofit partner. And we do absolutely measure outcomes of the clients we transfer into those beds, long-term outcomes, transferring clients to other shelter, long-term solutions. I would say those numbers are not high, but even helping one client get off the streets and get the help they need, get enrolled in Medicaid, mental health services, is quite a bit of work behind the scenes with our team with follow-up to get folks on the right track. And they're committed to that work. And we are happy to report that we do have quite a few success stories. It's a credit to our team. They really care. They're working hard. The ARU has dozens and dozens of resources and partners that it works with to try to assist many, many clients. Just to name a few, of course, the city of San Leandro. Our biggest partner is the police department. We would not be operating without absolute collaboration and a partnership with them. All of our calls are dispatched from the SLPD primary dispatch center, but also going further, the city of San Leandro's navigation center run by Building Futures. We work very closely with Care Court in California, and that's supported by Bay Area Community Services, as well as Alameda County Behavioral Health and Bonita House, just to name a few. This program is extremely safe, and the data has proven that out. Not only our program, but programs across the country. Provided proper dispatcher training regarding what types of calls the team can respond to. We've had less than 1% of our calls where we've required police assistance for backup. And that comes down to proper trust and training with our partners in police dispatch, and then our team on the scene assessing the situation. We had a feeling the success rate would be high, and it's proven to be that way. And we continue, of course, to emphasize responder safety and provide the training to our responders as well. And so far, that's proven to be very successful. The Alternative Response Unit would be a tremendous asset to the community if it became a permanent, fully funded alternative in the real fourth branch of the 911 system. We're not quite there yet, but the program has tremendous support already, and I think we're on the right path. The community sees the need. The city of San Leandro sees the need. We see the need. They're seeing that it's worth it, and I think we're working our way there. It would mean the world to this community to have a permanent response team in the city of San Leandro.